This is Dr. Beth Dineen. We are joined by Cameron Dezfulian, contributing authors to the Opioid-Associated Out-of-Hospital Cardiac Arrest Scientific Statement from the American Heart Association.
The number of opioid deaths in this country remain around 49,000 or so each year and really are at a high compared to a few decades ago. And we saw this, we meaning the critical care and emergency medicine communities in particular, saw this in the changing demographic of the patients that we were taking care of, where all of a sudden we started seeing a lot younger patients coming in with cardiac arrest. And very often when you would get down to it, it would turn out that the etiology of this was opioid poisoning that led to their cardiac arrest. That form of cardiac arrest, and for me as an intensivist, the brain injury that went with that looked very different than the traditional cardiac arrest, out of hospital cardiac arrest we were seeing, which often was cardiac etiology. And certainly if you saw it in a younger person, a lot of times it was a sudden cardiac death that was very amenable to a variety of therapies. Given how lethal this was, given what an epidemic it was, we really recognized that it needed to be discussed further.
Can you dive into that a little deeper and tell us more about what sets apart this opioid-associated cardiac arrest versus other etiologies as far as the epidemiology is concerned, for example, as it relates to age, CPR management, outcomes, or other factors?
The age of our average opioid poisoning victim is much younger. So the demographics are such that most of these patients are in their 30s and 40s. The second thing is by the nature of opioid use and poisoning, often these individuals are isolated. So they are either using opioids by themselves, or if it's being used in a group, the other people in the group are either impaired or for reasons of fear of being incarcerated or criminally prosecuted, don't want to report it. And so we have a large number of unwitnessed or at least unreported until it's too late cardiac arrests. And then the willingness of others to intervene in terms of providing initial resuscitation also can be a lot lower. That really depends on the setting, I think. The other part is just the pathophysiology of this, which is that most of these opioid poisonings result from essentially an impairment of breathing and respiration first, which then leads to hypoxia, and then ultimately that asphyxia leads to cessation of blood pressure and cardiac arrest. So that's a different sequence than the traditional sudden cardiac arrest, where generally the heart fibrillates or becomes ischemic and then is incapable of pumping, or just that the function is poor and then the patient arrests.